Assalamu alaikum. My name is MURTAZA MEHDI from uvas, Lahore. Today the topic of my discussion is thromboembolic disorder in a dog after Caesarean surgery. So now we have to move on to case history. Uh, we have a case of a 3-year-old Labrador Retriever female uh, who had given a Caesarean surgery 4 days prior to the presentation of the case. And in this case, we have seen the venous thromboembolism development in the female. And the initial presentation was the dystocia, secondary uterine inertia, and stillborn fetuses that lead to the venous thromboembolism. When the case was represented at day 4, the fever was 104.3 degree Fahrenheit and the state was lethargic and anorexic. Further, for the physical examination findings, we found mildly increased respiratory rate, mildly increased rectal temperature, and the animal was quite alert, responsive, with normal mammary gland secretions. The abdominal palpation revealed tenderness. The key laboratory findings at day 5 postpartum include the hematology, which shows the infection or something problematic in the reports, as showed the normocytic normochromic regenerative anemia, that's the reticulocyte count is high, hematocrit level is low, the severe leukocytosis with neutrophilia and left shift showed that somewhat bacterial infection is there. Also, the monocytosis were seen. The blood gas analysis showed that the oxygen perfusion is less and the respiratory effort was increased as 36 breaths per minute was seen. After the physical exam findings, they go for the diagnostic approach in which they did the DIC panel test, which includes the three basic tests: the D-dimer's concentration, the anti-thrombin 3 activity test, and the activated prothrombin time test. These all show the values that were in favor of DIC established. Diagnostic imaging, in diagnostic imaging they go for the abdominal ultrasonography, in which they found the lacy appearance of the spleen, which is due to the multifocal splenic infarcts. And on arterial blood gas analysis they found the alveolar arterial oxygen gradient, which was increased, and no detectable flow on the color Doppler was found. The tentative diagnosis was pulmonary thromboembolism on the basis of all these three tests. So have a brief look to the pathogenesis of postpartum VTE. The risk factors include the increased coagulation factors during pregnancy, also the obesity and the surgical trauma that they had given during the Caesarean surgery. Also the other factors were postpartum infection, which basically include the leukocytosis that increase the procoagulant activity and ultimately lead to the venous thromboembolism formation or blood clot formation in the veins. And we have diagnosed it by the splenic infarction, multifocal hypoechoic regions in the spleen. They treated the case with the fluid therapy and antibiotic intravenously. Also, the antiemetic meropenem citrate was given. For respiratory support, they had given the oxygen supplementation as the oxygen perfusion was dropped less than 93%. In this case, the patient was treated for 6 days and was discharged with oral amoxicillin for 14 days. The important point to be noted here is that the anticoagulant therapy should be considered in this case, but was not instituted in this case. On follow-up, the patient showed marked improvement in clinical signs, but the persistent lab reports were persisted for a week after the initial treatment. So they decided to increase their duration of treatment for an additional 1 month. Finally, the patient took about 4 months for the complete recovery from this case. These are the remarks by the author. Thank you so much for your patience. Allah Hafiz.